This video is going to be another one in the Problems With series, talking in this case about the problems with implants. So stay tuned until the end and learn what there is to know about implants and what problems they can cause in the short, medium and long term. If you've been to the channel before, great to see you back. If you're new to the channel, then welcome. This video is going to be another one in the Problems With series, talking in this case about the problems with implants. Implants can be used in a number of sites of the body. Probably most of you will think of breast implants when we talk about implants on a plastic surgery video, but there are many different locations where implants can be highly effective, and many of the same problems apply to all of those locations, but some of them are quite specific to the breast implant market. So stay tuned until the end and learn what there is to know about implants and what problems they can cause in the short, medium and long term. Implants can commonly be found in the breast, and this is something that many hundreds of thousands of patients in the UK have undergone over the years. The implant market has been in place since the 1970s, and implants have got progressively more technologically advanced during this time. They now come with a special kind of cross-linked silicone and special surfaces to minimize the problems. But as we all know, there are still issues with implants, both due to manufacturing problems, but also problems specifically associated with implants. I'm going to talk about breast implants and all the other types and what problems are specific to each. In terms of breast implants, then, this is an operation often chosen by young women in their 20s or maybe 30s. It's a life-enhancing operation which is often sold as a one operation and everything will be better. The cost is more or less affordable in the UK and in the USA. It's extremely popular. The operation is typically done under general anesthetic, and very little attention is paid to the effects of the implants to your body in the future. What we often find is that ladies with small breasts who choose breast implant surgery often go for a reasonably big implant to give them something they've never had. Now, this creates problems of its own. The difficulty is that the breast size and shape that you have when you're 20-something is very unlikely to be the same breast size and shape that you have when you're 40-something or 50-something. Now, this is compounded by pregnancy, which makes the breast tissue enlarge and then shrink again after the baby's born. It certainly is the case if patients gain and/or more specifically lose a lot of weight, and very noticeably with age, the breast tissue turns from thick, dense glandular breast tissue into much more fatty tissue. Now, the problem with fatty tissue is that it tends to sag more than thick glandular tissue, and if you have a large implant with breast tissue sagging on the front, then the two different volumes look quite unrelated, and we see almost invariably a patient who's had a largish implant put in their 20s. By the time they come to their 40s or even certainly their 50s, then the implant and the breast itself no longer look like they were ever designed to be together. And this raises a significant problem, which is breast implant surgery almost always requires a second or even third or even fourth operation. And this is problem number one that I wanted to highlight. The difficulty is that as the breast changes and the implant and breast no longer look like they belong together, then there's only two options. Option number one is if the breast itself has become saggy and there's not enough volume to keep it inflated and perky, then patients often opt to have a larger implant put in. As you can imagine, the problem that we had to start with is that the implant was too big for what we now have in terms of breast volume. So putting a larger implant in, unfortunately, just leads the patient to need another operation further down the line. Essentially what you're doing is kicking the can down the road. You're creating a problem whereby as the breast tissue involutes and shrinks even more with older age, then the same problem is likely to occur, but to a greater degree, because you now have a bigger implant than you ever had. The other option is to tighten the breast tissue, which means that the skin and the smaller volume breast that you now have is once again related to the implant. The difficulty with this operation, called a mastopexy, is that either it creates scars around the nipple as a minimum, or if the tightening is more extensive, then it can create quite significant scarring under the breast and into the crease. Now, for all implants, patients would very much like them to be natural, to be invisible, and for the scars to be as invisible as possible, if not completely invisible, and to have a lifelong effect. As you can imagine, breast implant surgery doesn't qualify for many of these, and in the vast majority of patients who need additional surgery, the additional scarring is something that they almost certainly never signed up for. In the vast majority of cases, it's good and acceptable quality, but there is no guarantee that this will be the case, and in some patients these scars can be problematic. Even when they're good, they are nowhere near as invisible as the original breast implant scar, and as you probably know, once you have scars, they are for life. Other implants that we see commonly in plastic surgery include locations in the face like cheek. The tip of the chin is a good place for an implant. I've seen patients requesting more commonly implants to strengthen the angle of the jaw. We also see implants for the pectoralis muscle to make men's chests look bigger. We see implants in calves to make men's calves look bigger. Some of these implants don't have the same problems with skin stretch like the breast implants do, but some of them do. For example, pectoralis implant or calf implant both can lead to stretching of the skin. The chin and the cheek implants tend not to do this, but unfortunately, specifically for the cheek, what we often find is the soft tissue fat of the cheek does exactly the same as the soft tissue of the breast, namely slide lower on the face as the patient ages, and we often see the implant and the cheek no longer being friends anymore, and you're left with a similar situation whereby the implant becomes visible, and the only option really then is to remove the implant altogether, leaving you with a very flat, underinflated cheek, or to lift the cheek tissue back in front of the implant, which is either a mid-facelift or a facelift surgery. Again, many patients who opt to have facial implants don't imagine that they will need revision surgery, but this is sometimes the case. Thankfully, chin implants, as long as they're screwed into the bone, tend to cause fewer problems in terms of this soft tissue dynamic change, but the pectoralis implant can very much have this problem as the pec muscle loses volume with age, and the calf implant the same. Another concern with implants, which should certainly be discussed with you at your time of surgery, is specific implant associated problems. And unfortunately, these are manyfold, although thankfully rare. We see problems with a biological phenomenon called contracture. This is where a thick scar band forms around the outside of the implant and then tightens. For a breast, this makes the breast look extremely stiff and overly perky, too high on the chest, and can cause pain. We see this less commonly in the face, but again, pectoral implants and calf implants can undergo the same problem. An implant problem which is common to all locations is infection. Now, we do everything we can to minimize infection around implants, but if you are to develop one, then the likelihood of it being able to be cured without removal of the implant is very slim, probably 10 to 15% at most. If the infection can't be treated with simple antibiotics, then unfortunately the implant needs to be removed. Now, as you can imagine, if there's two implants creating asymmetry, then removing one of these implants is a disaster, especially if it's in the face or in the breast, where this loss of volume on one side cannot easily be hidden. Once an implant is infected and it has been removed, then the patient unfortunately needs to spend at least 6 months without an implant, which will give them some degree of deformity for this time. A complex decision has to be made regarding whether more implants should be placed. In my experience, there's a small group of patients who do not tolerate implants well, and if they had a problem the first time, then I think the likelihood of a problem the second time is higher. This again is something that people don't necessarily take on board when they have implant surgery. They assume everything is going to be fine, but if it isn't fine, then actually it can be very, very problematic to encounter some of these problems and manage them. There's a rare but well-documented illness called breast implant disease, and this has a number of psychological effects and also pain and mood disorders, which can only be improved by removing of the implants. The difficulty is, as far as I know, there's no clear predictor of who is going to suffer from this problem, but if you do, then unfortunately your choice to have an implant will be proved to be suboptimal, as the only effective treatment for implant disease like this is to have the implants removed permanently. As most people are aware, following the PIP scandal in 2010, implant quality cannot be guaranteed. To the best of everybody's knowledge, the PIP implants, which were from a French company, were safe and acceptable, and only 5-10 years later did we realize that the quality of the implant was very poor. The silicone used in it was never designed to be used inside the body, and multiple patients needed the implants removing and replacing. Unfortunately, because the company went bust, then none of this additional surgery was covered, and many patients had to foot the bill or endure the symptoms of ruptured or fragmented implants until they could afford the time and the money to have them changed. This unfortunately made people acutely aware that implant surgery is not completely without long-term concerns or risk, and I think this case should be of a valuable lesson to everybody who's considering having implants in today's medical environment. Something else to bear in mind is that implant surgery for patients in the UK is often performed in places like Turkey, where plastic surgery and the implants themselves are much cheaper. The rules and regulations around which implants and which surgical techniques that are used are somewhat more lax in Turkey, associated with the cheaper price, and unfortunately, should you have a problem with one of these implant surgeries, irrespective of which part of the body in Turkey, then the trip back to Turkey is not necessarily easily performed, and the surgery to improve things for you is not guaranteed or cost-free necessarily. Many of these patients unfortunately rely on the NHS to have their implant problems improved, which may end up meaning they pay for their surgery twice, which again is something to bear in mind. It's also important to tell any surgeon or dental practitioner that you have implants, as sometimes there is a lower threshold for giving antibiotics, because implants, although rarely, can become spontaneously infected because of other infected surgical procedures. We see this with orthopedic implants like hips and knees, and it can, although rare, happen around plastic surgery silicone implants as well. Having said all of this, there are patients who've had breast implants for 40 years, who've never had them changed, who've never had any problems, and this is more common than the unfortunate alternative. But breast implant surgery and implant surgery in general is on the rise. I, as a facial plastic surgeon, see a significant increase in cheek implant and chin implant requests. In my practice, these are safe and reliable operations, but it's important for all patients to consider that it is not one operation for life, and in fact, in the case of breast implant surgery, it can quite easily be 2, 3, or 4 operations before you are completely over the breast implant experience, and so it's important to bear this in mind when you have your discussion with your potential breast implant or facial implant surgeon, to know all the facts and figures, not just for today, but for the rest of your life. If you've enjoyed this video, then please like, subscribe, and by all means go and have a look at some of our other videos on YouTube discussing different plastic surgery topics. Otherwise, I look forward to seeing you on the next one.